This is Selma Schimmel at the 46th Annual Meeting of the American Society of Clinical Oncology, and I am sitting with President-elect, incoming President of ASCO, Dr. Michael Link. Hello, Dr. Link.
Hi, how are you?
Well, I'm thrilled to have you here because not only are you the President-elect, but you are a pediatrician. You are the Lydia J. Lee Professor of Pediatric Oncology at Stanford University School of Medicine. And I highlight the fact that you're a pediatrician because coming in to ASCO with the perspective of pediatric oncology, young adult oncology, adolescent oncology, I think is going to bring a dimension and a depth to ASCO that is different than prior perspectives. And as a young adult survivor, not only do I congratulate you, but I have to tell you I'm terribly excited.
Well, I'm excited to do it. There are many ramifications for this. First of all, of course, it's you and the folks like you that make me do what I do, and is the reward for what we do to see our patients grow up. And so we do have a unique perspective because our patients become our colleagues, and that is going to become one of my themes for my year for this meeting. But it's also, I'm the first pediatric oncologist to be the president of ASCO. So it's an example of how diverse ASCO's constituencies are and how they understand that all of us are really part of the fabric of oncology. And as you'll hear from some of my themes, I think the distinctions between pediatric oncology, surgical oncology, and medical oncology are blurring perhaps as we understand more about cancers and how we treat them.
The theme for this year's meeting, Pathways, Progress, Patients. What does that mean to you?
Well, it's an important theme. George Sledge, the current president, has an interest in how the biology of cancers is going to be an important part of understanding cancer and how we manage our patients. Of course, patients is center to everything that we do and the final common pathway of what we do. But as he showed us in his presidential address today, the idea that we're going to have to understand the molecular pathways in cancers, and that is going to be the key to really giving the appropriate therapy for each patient, and also understanding that this is how the new understanding of the biology of cancer. This is the pathway to successful treatments. I think that's going to become more and more evident for all of us in the next, hopefully 5, but certainly in the next 10 years.
And as a pediatric oncologist, it's really got to be so significant that it's the youth that will take the most benefit out of this new generation of molecular and biologic therapies in a way that the older generation of cancer patients did not know or are still yet to know.
The themes that emerged from George's year as president are themes that we actually understood in pediatrics many years ago. So what are the problems? We have understood for some time that cancers that we see are really much more heterogeneous than we like to imagine. And we learned this lesson mostly from acute lymphoblastic leukemia, the most common childhood cancer. We began to realize in the early 1980s that if one looks at the molecular level, first from the cytogenetic level and now with molecular studies, that ALL is not one disease. It's 20 or 25 different diseases. And as we further do a complete sequencing of cases of leukemia, we're finding it's even more heterogeneous than we thought. And what we've been able to take advantage of from that is to really understand why certain patients do very well and why certain patients don't do well with similar therapies. And understanding what underpins that, that there are some patients who have very favorable forms of leukemia, whereas others on a molecular level have much less favorable outcomes that we can predict. And we understand they all look the same under the microscope, but we can now say, you're a patient who should do well. Our goals have become to actually reduce the toxicities of therapy, to discover what is the minimum therapy that's necessary to cure that patient, to minimize the long-term side effects. On the other side, we have the patients with much higher risk disease where we need to sort of develop more intensive, more intelligent therapies, I tell you, in order to really tailor the therapy. So we've known this for, now it's 30 years. We're finding this out in adult cancers, that breast cancer is many different diseases, lung cancer, many different diseases. That's a theme for all of us.
And it's probably worth pointing out that one of the reasons we've seen such fantastic successes in the pediatric cancer arena is that the number of children that are on clinical trials, something like 70% compared to the adults were, you know, 5%, and that is very significant.
Well, you're leading to exactly the themes. Some of the themes for my meeting for next year really emerge from what we have learned from pediatrics, what can be accomplished because of some of the things we've done. Collaborating. One of the key things that we do in collaborating with each other, in addition to collaborating with other disciplines, is our reliance on clinical trials. We can't advance the field unless we collaborate with each other, and that's why such a high proportion of patients are entered onto clinical trials, and I think that this has been a key to this development of successful therapies.
All right, Dr. Link, in closing, you have a theme.
Well, realistically, I think there are things that we, as you say, the perspectives that we bring from pediatrics to this job as the president of a multidisciplinary society, there are lessons that can be learned. I think one of the key lessons that I've learned about why and where we've been successful is that we've done it through collaboration. And this is collaboration with other disciplines, collaboration with basic scientists and understanding the fundamental molecular biology of the cancers that we treat. And most importantly, I suspect, is collaborating with our patients. Our patients are not just our patients are really collaborating with us as advocates for us, and also in participating in our clinical trials. They're our partners. And so I think we have to acknowledge this. I think that this is a way forward. And so my theme is going to be something of the order of conquering cancer through collaboration. And in addition, I think a sub-theme will be the importance of learning from each patient. We're emerging into an era of cancer therapy which is more and more individualized, both in terms of the specific molecular abnormalities in the cancer and the specifics of the patient's genome, and how they metabolize drugs, and this personalization of medicine, so that we have to treat each patient individually and learn from each one, so that we can continue to have the kind of clinical trials that will help us develop drugs for these multitude of cancers.
The timing to have you lead ASCO it's just fantastic, because it's, as you said, what we've learned from pediatric oncology, taking the best of that, integrating it into now adult oncology as well, and your vision. Again, congratulations. 2 more days to go. That's it.
Thank you.
Dr. Michael Link, President-elect of the American Society of Clinical Oncology, ASCO, for this year starting 2011. You are also Lydia J. Lee Professor of Pediatric Oncology at Stanford University School of Medicine. Privileged to talk to you. Thank you so much.
Thank you.
Congratulations.
It's my pleasure.